you. 5 on your mental health tonight. As we've been reporting, the nation's top doctor now demanding warning labels for social media apps.
Here to answer questions is Dr. Erica Lee, a psychologist at Boston Children's Hospital. Dr. Lee, thanks for being here. We've talked a lot about the mental health crisis among teenagers. So now the Surgeon General is saying that social media is a, quote, important contributor. Do you agree? I imagine you do.
Yes, this definitely warrants very careful consideration, especially coming from the Surgeon General. We know that there's research showing that social media can have a very real and very harmful impact on our young people. And Dr. Murthy cites some really important findings in his article, right? That one, using social media for more than 3 hours a day doubles the risk for anxiety and depression among our teens. And many of them are using much more than 3 hours a day. And almost half of adolescents are saying that social media makes them feel worse about their bodies. We know that kids who are already vulnerable to experiencing mental health challenges are at higher risk. So we really want to be thinking about why we would want more awareness and better decision making around social media. That's a good thing.
You know, what folks may ask or wonder, why push so hard for warning labels?
Right, because the idea of a warning label probably sounds a little bit scary. So a Surgeon General's warning label basically tells parents, we do not know that social media has been proven to be safe. It's really just one way to alert parents. You should be aware of the risk of social media use on your kids, especially on their mental health. So that may make you more mindful of how often are your kids using social media? How are they using it? Should I be teaching my kids to use it responsibly and safely? And also it's kind of a little push for social media companies and policymakers to work to make these apps more safe for kids.
So what's your advice for parents if their child is already using social media?
Yeah, great question. So we know social media isn't all bad or all good. I think that could be an easy thing to kind of go to when we have these new news announcements. It can be a really important source of connection and community. And the goal here is not to say we want to eliminate social media. And Dr. Murthy actually has 3 tips for families if your kids are already using it. So one, making sure that you're talking to them. How are they using it? And really importantly, how do you get help if you're getting bullied or harassed while using social media? 2, you need to set boundaries in your family where you have tech-free zones or tech-free times of the day where kids don't have access to screens, so it's not just free reign all day. And then 3, try to partner with other parents to establish some of these clear limits so you're not the only family where the kids are saying, but all of my friends get to do this. You can decrease peer pressure by banding together.
Yeah, some good advice. Dr. Erica Lee, we always appreciate your insight. Thank you.
Great to see you.
Yeah, thanks, Dr. Lee.